Okay, my talk is about what's ahead. Before we look at the future, I think we really also need to have a look at the past to see where we've come from. Kieran Henry, in his introduction yesterday, was talking about elders, high kings and kings gathering together to share knowledge and information. Well now, I'm none of those, but I do work for a king, Dr. Jeff King, which more than qualifies me to talk, I can assure you. Over the last decade, there has been a remarkable change in the pre-hospital emergency care environment in Ireland. We have seen the change or the transition from vocational to the academic training model, and Professor Bury has given a view of what's further ahead. Paramedics or pre-hospital emergency care practitioners are now registered. You were the 6th statutory healthcare register in the country. You were registered ahead of physios, OTs, speech and language therapists, etc. We have incremental care levels that include responders and practitioners. We have national examinations, certifications and awards. Practice is guided by a comprehensive set of clinical practice guidelines which have been adopted internationally in 2 other jurisdictions. With respect to service delivery, we now have dynamic deployment in certain areas. We have rapid response vehicles, we have advanced care paramedics. Just to put some numbers on this, the change in the decade was, we have care levels now over 6 levels, going from cardiac first responder to advanced paramedic. 10 years ago, 9 years ago, practitioners were giving or administering 4 medications without any legal basis. They now have access to 40 medications. 319 clinical practice guidelines spread over 6 different levels. Training institutions, a lot there, but the big increase there shows the integration. We're not just pro-ambulance, we're pre-hospital. You're talking about all the voluntaries, the auxiliaries, the privates, etc. And with respect to standards, there are now 8 operating standards and there are 6 information standards have all been created. So, how did this come about? How did, to quote Professor Bury, how did the van driver become a registered healthcare professional? Well, the reason why it came about is most of the people lurking or skulking at the back of the room there, the paramedics or pre-hospital emergency care practitioners on the ground, bought into it. They bought into change. There are 3 players in the game. There are the practitioners, there's the service providers, and there's the regulator. And what they have done is they have travelled together on a journey of change in partnership. Title of my talk is What's Ahead. However, before you can go ahead, before you can deliver the future safely, you must have the infrastructure in place on which to build. And that is what FEC have been working at. And we have what we termed, or like to call, a triple lock framework in place that firstly protects the patient, but it will also facilitate future development of EMS and facilitate new initiatives and new methods of delivery. Legally, now, in order to practice, you must be registered as an EMT, a paramedic, or an advanced paramedic. Service providers must be licensed or authorised by FEC to implement CPGs at particular levels. A practitioner's practice is governed by A, their status on the register, but B, it is governed by what CPGs they have been privileged to implement by their service provider. The service provider privileges practitioners. So, the practice regime that we're looking at centres around credentialing, licensing and privileging. This slide here is represented in 3 cogwheels. The idea being to show the link between them. If one of the cogs doesn't work, none of them works. So, all three have to be in place. Practitioners must be credentialed, service providers must be licensed, service providers must privilege their practitioners. So we have the team in place, the partnership, we have the infrastructure in place to facilitate future developments. In order to go ahead further, to deliver more change, in order to go ahead and even think about delivering some of the exciting stuff that has been mentioned over the last 3 days, the third link in the chain is we need more buy-in, we need more responsibility, we need people to take ownership for what they're doing. And by that, I'm talking about practitioners. You must be credentialed and registered. You must maintain your competency level. You can only practice on behalf of a licensed service provider. You can only implement the CPGs that you have been privileged to implement. Service providers must be licensed. They must monitor and maintain the competence of their practitioners, and they must train them in new skills as directed by the CPGs. They must privilege their practitioners. FEC, maintain a register, credential, fitness to practice if required, licensed service providers to implement CPGs according to their requirements, and most importantly, continue to develop and implement CPGs, or to develop CPGs for implementation. Finally, crystal ball, if I can have 30 seconds. This is what I'm talking about, the future. Okay? The future, the only definite is change. If you don't like change, you're in the wrong profession. Okay, just a few brief glimpses, crystal balls, what FEC believe. First of all, there are new CPGs 2014 just about to be launched. There will be a new field guide, there will be a field guide app for the first time for your phones within 2 months. Continuing professional competency is on the way within 6 months for all paramedics and advanced paramedics. We believe advances in scope of practice will be developing, especially for paramedics. We believe there will be increased specialisation. We're talking about community paramedics, we're talking about intensivist paramedics. We're possibly talking about, coming from advanced paramedics, physician's assistants in EDs at some stage. We're talking about graduate practitioners being the norm in the future. We're talking about more research and publications coming from existing pre-hospital emergency care practitioners. We're talking about the consolidation and the maturing of the EMS profession, which has been emerging. And finally, all of these can be built and progressed on a framework of credentialing, licensing and privileging. Thank you.